The Wellness Center in Manhattanville is going to be providing a very critical service to the community. At the Jerome Green Science Center, I will be running with a stellar team, a community health worker training institute. So we are going to be recruiting community members from churches, from community-based organizations, from senior centers, housing projects, anyone who is really committed to the issue of health and advocacy. And we are going to be empowering these individuals to not only be advocates for health in their communities, but also to be able to deliver very basic, what I call primordial healthcare services within the community.
We call it the Community Health Worker Stroke Prevention Program. It's based on the community health worker model, which is using people who live in a community as health workers to actually go out and assist people in getting in for medical care.
Well, I've learned a couple of things, how to take high blood pressure and also how to measure for diabetes. And I think those things are important because our community is disproportionately affected with these two diseases. And instead of having to wait on doctors and professional folk to come in to do this for the community, we will be able to do it ourselves.
I do feel that this has been a great experience because you learn so much more than the motivation and the compassion and just knowing what different illnesses are that inflict on people every day.
We're suffering so much from high blood pressure, from diabetes, from cancer, from not having the proper health insurance. So all of these different pieces of information we're learning so that we can bring it to the congregation and present it so that they can become healthier.
Yeah, the church that I attend and serve, the congregation is predominantly Hispanic. And one of the things that I was talking to my pastor about was about like health.
So we will teach and empower these individuals with the skills of motivational interviewing that they can take into their communities. We will also empower them with technical know-how to screen individuals, at least blood pressure screening, cholesterol screening, diabetes screening.
I can give you a pill for high blood pressure, but I can't address all the things in society that makes it hard to lower that high blood pressure. Our communities and our society is what we need to fix that problem.
We are involving people who help us guide people on how to navigate the health insurance field, to get where they need to get in to see a doctor. We are providing referrals. We are linking to a community center where people can walk in and sit down and have their blood pressure checked.
So it has been an inspiration to me. So it's going to give me the wherewithal to go out and do more than what I'm doing now. So it's been a pleasure meeting and working with the people here. And I want to commend Columbia for bringing this kind of program into this community.
So the Wellness Center is going to be providing a very critical service to the community, and it's going to become very quickly one of the pearls of the Columbia system.